listening to the Pharmacy Podcast Network.
Welcome to This Week in Pharmacy. I am your host, Todd Uri, founder of the Pharmacy Podcast Network. How has your week been? Wow, it's July 12th. Summer is going way too fast. Summer's my favorite season. My birthday's in the summer. There's vacationing in the summer. Get to spend more time with my kids. I just don't want to see it go. We're halfway through the summer. We have a heated pool, which is nice. Got this thing like 5 years ago, and it extends the life of us in the cold waters of southwestern Pennsylvania. Before we got that heater, it would take nearly into halfway through July or August to get the water warm enough. I don't know about you, I like a 76 to 86 range of pool water. And so I keep it right around 85. I don't know. So we have a lot going on this week. Going to jump right into this show. Hope it's been a great week for you. Shout out to Marina Buskov, who is a Pharmacy Podcast Network host, the Holistic Pharmacy Podcast. She did a recent episode called How Your Face and Body Can Open You to Receive More of What You Say You Want with Tammy Cho. This is a really interesting discussion. This is a mind-altering discussion in some ways because you might not realize the impact that you get for being authentic and at peace, in alignment with your true self and what that means and what you're putting out in the world, as well as how people perceive you. Also, a shout out to Bruce Nealon. He interviewed Salim Shah, who's a veteran pharmacist and pharmacy owner. And this guy has put together a team of experts launching something called the Collaborative Patient Care Group. And they're really drawing upon the expertise and connections in durable medical equipment, using technology and hiring, training scores of customer service people that they are helping pharmacy to provide current patients with a lot of needed products and services that's going to come through the community pharmacies, especially with the expansion of home care. So don't, if you're a community pharmacy owner, independent community pharmacy owner, don't play short on what home care is going to do for your business and the expansion. So take a listen to Pharmacy Crossroads if you haven't already. Also, a conversation with Pepper Center, a conversation between Mark Fulton and his group through the Framework Focus podcast. We love working with soft writers out here in Pittsburgh, Pennsylvania. Dr. Fulton converses with Dr. Stephen Albert and Dr. Amy Pickering from the Claude Pepper Center in Pittsburgh and the University of Pittsburgh. And the center is 14 centers throughout the United States that's funded by the National Institute of Aging. This is a really interesting discussion. I want you to listen into this, the pedigree, the history. And then I also want you to take a listen. Why independent pharmacy? Why is it necessary? Where are we at with this? I want to give a shout out to the Counter Talk podcast, which is part of our network by Cardinal Health. Thank you so much, Cardinal Health, for all of your efforts to bringing attention to our network for different things that are happening in community, and how Eric Hudson is building a brand new way of doing business as a community pharmacy through Western Medical Equipment and Drug in Woodward, Oklahoma, who not only shares his journey into pharmacy, but also addresses what he's doing to encourage his 7 pharmacies, 5 medical supply locations, and over 90 employees to meet their community members where they are. This is cool. This is going to be a cool story. I want you to listen to Eric Hudson's story on Counter Talk. And we have 2 special guests. I want to shout out to what it means to be a leader in pharmacy. I want to give a shout out to my friend, Canol Viaz. He's CEO and co-founder of RX Mile. If you don't know about these guys, look them up, rxmile.com. They're a logistics and strategic partner to community pharmacy, independent community pharmacy, as well as small health systems, hospital systems, long-term care organizations, and even specialty. This guy's really impressive. Stay tuned for a special series that's going to be co-hosted by Knoll, and I'm going to have the pleasure of talking with him about what he's doing to leverage technology and GPS and how the Ubers of the world are getting deep into health. And I see it as the difference of being the independent community pharmacy who is extremely detailed, oriented to their community based on just being part of it, and the big box companies. And even though we need the big box companies, we need Walgreens, we need CVS Healthcare, but we need it to be balanced. And we know that it's not. So he reminds me, Knoll and RX Mile reminds me of that independent community pharmacy owner to push out their technology that has been specifically designed with independent pharmacies in mind, and the tie-ins to your pharmacy management software system. So I think that's very important. Check them out at rxmile.com. Prescription delivery software. It's just a really interesting system. So check them out. Hey, have you been paying attention? I know that Twitter, AKA X, has changed over the years. It used to be one of my favorite social media platforms, and pharmacy was booming on Twitter under the hashtag TwitterRx. And then, of course, a lot of people's opinions got involved in who owned the platform and how the platform was being used in politics. And for me, I just kept using it because I love the platform. I didn't really get into the people that own it and the politics behind it, because it was still an extremely important part of my community and listening. And it's growing back. It's coming back. So I'm seeing a lot more interaction on Twitter. If you are on Twitter, please look at us. We've been there since 2008. Goodness gracious, I'm getting old. And we've been tweeting under @Pharmacy Podcast since 2008. And I can say that we helped, our network helped, all of our hosts over the years have helped to build that community. It's just wonderful. And I want to thank you. I use hashtag TogetherRx a lot so that we can talk about different things. But the reason why I'm mentioning Twitter, Dr. Marion E. Mass, okay? Dr. E. Mass. You can find her at MASS_Marion, Dr. Marion Mass. She has been a patient fighter for years. I'm so impressed with her. I've been connected with her for over 10 years. And she in her profile, in her Twitter profile, it says wife, mother, pediatrician, gardener, writer, speaker. She's super into PBM reform, not so much for the reform in and of itself, but what that means for her as a pediatrician and how she sees the system just completely taking advantage of tax dollars and funding. I want you to follow her. She is just incredible. She posted a note between Senator Elizabeth Warren, and she signed it. And then United States Senator Mike Braun had signed it. And it goes through their latest stance and integration with drug supply chain in raising drug costs, which are already far too high, while undermining Congress' intent to improve healthcare quality, to examine the extent to which these corporations' price-setting strategies increase cost for patients and evade federal MLR requirements. We request that you conduct an evaluation consistent with your mission to provide objective oversight to promote the economy, efficiency, effectiveness, and integrity of the Health and Human Services programs, and that the evaluation include a review, and they go through a whole lot of information. So I want you to, if you want to read this full article, I'd like you to look up Marion Mass on Twitter. Go to her account and you'll see the full letter, or just look this up, obviously, on Google. But this is finally happening. We see that the FTC is not standing for this anymore. There was an article that was just posted on Forbes. It says FTC will sue pharmacy middlemen over inflated insulin prices, reports say. This is major, and this is the beginning. This is what we've all been waiting for. You know, we've been here 5, 10, 15, some of you 20, 40 years, and you know that this was bubbling when PBM started getting out of control, especially just about 10 years ago, more so than ever. And when you go through this, it says that the Federal Trade Commission is going to sue the 3 largest pharmacy benefit managers after the agency released a report alleging the companies which manage roughly 80% of the prescriptions in the U.S. were driving up prices of some medications like insulin while pushing customers away from cheaper alternatives. We know this has been going on, but I love that this is finally getting the attention that it deserves. No one remembers, I'm sure, listening to this podcast, when the baby bells in the United States, the telephone companies, the local companies got broken up. I want you to look up divestiture and of the telecom companies. And I can see that this is going to become a way for us to break up the stranglehold that the PBMs have on our profession. And some critics will say, when we say Pharmacy Podcast Network, that you guys talk about PBMs all the time. And I think some of those people are tied to PBMs themselves. So they're defending it. Listen, there's nothing wrong with the structure and the meaning of what a pharmacy benefit manager was originally supposed to do. But when you are destroying our profession and pharmacists are leaving and technicians are leaving and we can't attract good people to work in community as they should, and it's all about the volume and not about the care. When you place money ahead of what that money is supposed to be trickled down to, it will take a macro effect and then eventually micro economic effect to the regions that are now without pharmacies because of these unsustainable business models that are profit driven. When that happens, there's a revolt, and that's a revolt is happening right now. So you listening to this podcast, you pharmacy professional out there, you're part of a revolution time in our profession. This is very big. And if you'd like to be a bigger part of it, we do have a program called PBM Reform Podcast, and I'd like to talk with pharmacists in different sectors of healthcare who can come up with solutions. You know, poking at PBMs is not enough. We can't even wait around for what's going to come from the FTC's suing these 3 big PBMs. And they have so much, they have gobs and gobs of money to defend themselves and put the lawyers on it. It's going to take a long time to get through this. So there's a lot of players out there. Shout out to you Mavericks, you pharmacists out there that are doing things on your own without waiting for this. And that's kind of what I want feedback on. I want to see what programs you can come up with in community and in geriatric care and pediatric care, like Jenna Quinn, and she's just ripping it up. But think about that. I also want to talk about ethics. You know, today's episode is all about leadership. I'm excited about today's episode. You're going to hear from 2 leaders in our pharmacy profession, Dr. Jerrund Wilkerson. He's going to be talking to us. And then Waypoint co-owner, Matthew Coakly, both leaders, very interesting leadership stories. But I want to talk about what does leadership mean, and the tie-in to leadership is ethics. There's a lot of ethics that goes into pharmacy. There's a lot of ethics that go into running big pharmacy corporations like CVS and like Optum and like Express Scripts. Leadership is necessary. And what does that mean? Ethics have to come into this, right? On July 10th, an unmarked cars and secret orders were put into place down in Texas, and how a pharmacy prepared drugs for Texas executions. This is a really interesting story off of NPR, npr.org, and the title is Unmarked Cars and Secret Orders. Just look that up if you want to read it. And it says that the state of Texas blocked from purchasing lethal injection drugs by major pharmaceutical companies that refused to participate in executions, brought them instead in an in-state compounding pharmacy with a history of more than a dozen safety and cleanliness violations, NPR has learned. And then it goes through the name of the pharmacy is a right-away pharmacy and medical supply in suburban San Antonio, produced injectable from injectables from 2019 through at least late 2023 for Texas to use in executions records from the state Department of Criminal Justice and the Federal Drug Enforcement Administration revealed. So I want to talk about this because one of our new series coming up is coming from the Pharmacy Ethics and Education Resources. That's the Pharmacy Ethics and Education Resources, known as PCCMatthew. This is run by Dixie Lecoq, and she's just brilliant, including 7 of her advisors that are growing this organization, and led by Dixie. She's the CEO and president of PEER, and it's a nonprofit organization dedicated to promoting ethics in pharmacy. Like, this is really interesting. This is how we continue to improve our profession and bring a level of constant evidence-based driven quality to the care that is out there. So I want you to look up this organization. It's at PeerRx.org. Once again, PeerRx.org. We have a great show. I've been thinking about you a lot, coming up with the conferences that we're going to. We are going to the National Association of Chain Drugstores, the NACDS Total Store Expo. That's going to be in August in Boston. If you're going to the NACDS Total Store Expo, the TSE 2024, please let us know. Let's connect. We will be covering that event as press. We're excited. And then the Super Bowl of Community Pharmacy, the NCPA, the National Community Pharmacists Association, is on October 26th in Columbus, Ohio. And I get to drive instead of being in Germany airports. I always get sick I don't always get sick, but if I get sick, it's because I was at an airport. I don't like airports, even the cleaner ones per se, but I don't have to travel through an airport to get to Columbus, Ohio, which I'm excited. So we'll be driving from Brownsville, Pennsylvania. It's going to take us about 3 hours to get there. If you are going to the NCPA, be a part of our programming. Get together with me and let's talk about the profession. Let's talk about moving the profession forward, especially community pharmacy, independent community pharmacy. I'm excited about today's show. I'm excited about sharing these two wonderful pharmacy professionals with you. And I hope you have a great week. Make sure you reach out to us on Twitter at Pharmacy Podcast or on Instagram at Pharmacy Podcast. And if we're not already linked up together on LinkedIn, make sure you send me a request at Todd Uri. But let's get on with the show. And I hope you have a great week on This Week in Pharmacy.
At the Waypoint Company, our sole purpose is to empower independent pharmacy owners because we know you are the heartbeat of your community. We know the challenges you face, and that's why we deliver new ways for you to thrive outside of the PBM model. From helping you keep your most valuable employees to providing proven ways to earn new, sustainable, and profitable income, to simply saving money. We're here to help your pharmacy thrive while protecting your financial independence. Waypoint is more than a company. Together, with the pharmacy owners and communities we serve, we're a movement. Together, we are reclaiming resources being stripped away by profit-first, people-last big business. Waypoint Company, your partner in prosperity. Join the movement today by visiting our website at waypointus.com.
The Waypoint Company, this is a special organization that has understood the track, the pathway, and the transformation of what has to happen in independent community pharmacy for us to thrive. I'm here with Matt Coakly. Matt, tell us about yourself. How'd you get involved in pharmacy? And we want to start reviewing some of the Waypoint programs.
Sure. So I'm the CEO of what we call the Waypoint Company, which is a conglomerate of other companies that basically work together to help community pharmacies survive and really thrive, which is obviously everybody knows what we're going through currently, so that becomes more and more important of a thing to do. Probably, let's see, I just hit year 15 with the company, so we started out working with pharmacies a long time ago. My dad is a financial planner, kind of an insurance guy at heart. and he was helping pharmacy owners work on their long-term financial independence back to the early 80s. My brother got out of school in 2000, went to work for someone else as dad required before he'd come into the family business for a couple of years. And in 2003, Ben came on full-time, and he rewrote our marketing plan. He's a marketing guy. And one of the things he did was segment our clients by profession. And we realized a large portion of our clientele were community pharmacy owners. And it just dawned on us like, hey, let's go figure out what these people need us to help them with, and then figure out a way to do it. So we started really in about 2005, focusing primarily on community pharmacies as the largest segment of our business. And it's interesting because everybody knows how much pharmacy's changed in the last 20 years. So the conversations we were having back then were a lot different than the ones that we have now. Profitability was not usually even a factor. Everybody was making plenty of money. It was more of, how am I going to exit my pharmacy to sell it to the person that I want? Maybe I don't want to sell it to a chain, so let's start developing a successor. And we did a lot of exit strategy stuff. Now I'd say a lot of what we do is designed to help people hang on to their pharmacy, not necessarily transition out of it. But we're really big on revenue outside of the PBM model. Let's get some dollars flowing to the pharmacy owner that nobody's taking a piece out of, and there's no PBM or anything like that's in there clawing it back. So that's where largely the pharmacy insurance group came from. We started hearing a lot of our owners tell us, I'm doing all this Medicare work, and the insurance agent is making all the money on the back end. Is there a way that I can get paid for it? So we started working, we went to work to figure out how can we set this up in a way that is legally sound and allows the pharmacy owner or somebody affiliated with the pharmacy owner to capture the commissions for the work that the pharmacy's doing anyway. So that's probably our most popular initiative at this point. That's usually what everybody wants to talk to us about, but it's a good way. We've got agents that have six-figure streams of income coming in, and it's nice. It takes pressure off the pharmacy if there's more dollars flowing into that person. So that's a big one. We also have benefits packages where we help pharmacies go in and we evaluate what they're doing from a benefit standpoint, so they can retain and reward their most important employees. But also we found a lot of benefits are set up kind of haphazardly. They don't really have any structure. Maybe the pharmacy owner doesn't even realize what he or she's paying for it all. So we go in, we have a low-cost 401k and some other stuff where we can help them save that, which is a big deal. You look at health insurance for pharmacies that still can provide it, and the way the premiums are going up, we can go in and do an analysis of that, and a lot of times we can save the pharmacy owner a good bit of money by just changing the structure of their health plan a little bit. So we do a good bit of that as well, but really everything is designed to try to keep as much money in the pharmacy owner's pocket as possible, and in that community and in that town as well.
So talk to me about the insurance component and how you're working with Medicaid programs and how that ties into the community. Are the pharmacy owners approaching school districts? Are they approaching private employers? Talk to me about how that actually works.
Yes, some of them are. So most of our insurance agents are going to work primarily in the Medicare space, because that's where they're
space.
They're getting the most questions. So Medicaid plays a big factor too, because dual eligibles is a great spot for pharmacy owners or an agent that's working with the pharmacy, let's say. It's a good spot where they can both help the patient out a lot and make a difference in their bottom line by getting them on the right dual plan. But yeah, most of them are in the Medicare space, primarily because that's what they were doing already. But we have some, what I would call enterprising. Obviously, a lot of these people are business owners anyways. We have some that have put the effort in and gone out and picked up a lot of commercial health insurance plans, which are a different beast. They're a little bit higher service level, but they can pay pretty good commission-wise. And then, we have some people that are doing marketplace plans, like your traditional Affordable Care Act plan type stuff too. So that's all out there. And then we also, on the agent side, we recommend people get life insurance license at times. So whenever they're ready. Not everybody takes that jump initially, but we've got some agents out there that have done some life insurance and stuff like that as well. So all of those just add to the way that you can make money through the pharmacy insurance group.
That's excellent. So is it geographically pocket where you're seeing success, or you're just a national organization that's supporting everybody everywhere?
We support everybody everywhere. That was part of the fun part on how we set it up. It took us a little while from idea to launch, because our primary health insurance vendor that we use in South Carolina, we have a real good relationship with. They're licensed in South Carolina, North Carolina, and Georgia.
Okay.
And we talked to them, and they said, we don't have necessarily the capacity to do this on a large scale. But my brother had recently moved to Central Missouri. He actually took a CrossFit class, and the instructor of the CrossFit class told everybody he was a licensed insurance broker, so they ended up having sushi together afterwards. Turns out this guy was Scott Amos, who a lot of you people will know, that we've partnered with. Scott was already licensed in about 35 states.
Wow.
So he was already doing it on a big scale. But now the Pharmacy Insurance Group is in, I want to say, 47 states. It's pretty big. It works differently because Medicare varies county by county or city by city. In big cities, there are usually a lot more options. We've got some agents in Idaho that don't have a whole lot of options in terms of plans, but they're still helping people get on the right plan. So how you do it varies a little bit based on where you are, but there's people over 65 all over the country. So we can help you just about anywhere.
It's one of the most explosive parts of our population in demographics, with 11,000 new 65-year-olds reach that age every day for the rest of the year. So that is a big opportunity for community independent.
That's right. And those are the people that are taking the most prescriptions typically. And that's where pharmacies are just getting crushed with some of these plans. They're just not good. So, and we have a lot of conversations. So we believe in what our training is, and all of our agents buy into this, is we're going to take care of the patient first. So sometimes someone comes to me that is just on a weird mix, and there's no option other than a not great plan. And if my pharmacy takes that plan and I want to retain that patient, I'm probably going to put them on it. But there are a lot of times where it's close enough where you can sit down with the patient and you can say, this one's going to cost a couple more dollars a month, but if you get put on anything expensive, it's going to cover it much better, and it's a better spot for the pharmacy. And we found a lot of patients really do care about their independent pharmacy. As anyone listening to this would know, community pharmacies take care of their people.
Yep.
So I think a lot of people are okay paying $1 or $2 more in a monthly premium or in a monthly cost, and we can break it down and show them exactly what it will be. But really, most people don't even ask. Yep. Occasionally I get somebody that says, what would this cost if I went to Walmart? But most people really want to use their independent pharmacy, because you guys, the people that are listening to this, just do a really good job.
Yep. All right, so I'm listening. I'm a pharmacy owner. I want to move forward. How do I get a hold of you?
Sure, you can check us out at waypointus.com. That's kind of our big website. It'll take you down any path you want to go to with our programs. But you can call me on. Can I give them just like my cell phone number? Yeah. You can give me a shout. My cell phone number is 843-991-5002. You can shoot me an email. My email is matt@waypointus.com. That's waypointus like UncleSam.com. But we're constantly just trying to innovate and help people out as much as we can. But the Pharmacy Insurance Group is really popular. I think it's just low-hanging fruit. Everybody's doing the work. Let's just figure out how to get you paid.
That's awesome. We appreciate you. Thank you for sponsoring the McKesson Idea Share 2024 post show, and we can't wait to work with you in the future.
Yeah, we appreciate you guys too. Thanks for all that you do for the good of pharmacy as well.
Thank you, Matt.
Thank you.
Hi, I'm Kunal Vias, co-founder and CEO of RX Mile. Are you ready to take your pharmacy business to the next level? Join me on the exciting journey as I sit down with Todd Urey from the Pharmacy Podcast Network in our special episodes, The Last Mile with RX Mile. We'll be diving into how RX Mile is revolutionizing the way pharmacies operate, from enhancing patient adherence to streamlining delivery services. Learn about our cutting-edge solution that is transforming our industry and hear success stories from pharmacy owners just like you. Don't miss out on this chance to stay ahead of the curve. Tune in to The Last Mile with RX Mile, available on all major platforms. Subscribe now and elevate your pharmacy with us. See you there.
Hey, on This Week in Pharmacy, we're going to jump back into the concept of leadership. And as you've been aware, we've been touching on what is leadership, how is the impact of pharmacy care impacted by leadership? Leadership is the ability of an individual or a group of people to influence and guide followers or members of an organization, society, or team. Leadership is often an attribute tied to a person's title, seniority, or ranking in a hierarchy. Now, that's the black and white cold definition of leadership, but I'll tell you what, so much more goes into it. And I want to introduce to This Week in Pharmacy a brand new friend of mine, somebody I met through LinkedIn, Dr. Jerrund Wilkerson, who is a leadership coach and pharmacist believer like me. You're a fan of pharmacists, just as I am, and I wanted to welcome you, Jerrund. Thank you for being here on This Week in Pharmacy.
Thank you, Doug.
All right, so leadership leads to a lot of things. A lot of decisions can be made. Some of those decisions can involve multiple people. Sometimes it's just one-on-one, maybe between the patient and the pharmacist, or the physician and the pharmacist. Hospital News recently wrote an article that just came out. The title is Navigating the Complexities of Healthcare, Linda Epstein's Leadership at Broward Health. And this is a great article, like I said, out of Hospital News Healthcare Report. And it goes on to talk about how Linda is leveraging her unique background and position, also a legal background as well, to really emphasize the need for leadership refinement, and how that important role as leader, as well as the theme of leadership, can trickle down and impact patients and the care of a patient and the way that they feel of the services that they're getting from a pharmacist or a physician. So talk to our listeners right out of the gate, Jerrund. Tell us a little bit about yourself and why you're passionate about the role of a pharmacist in leadership.
Well, thank you, Todd. And how long do we have? Did you say about 5 days? No. Okay. My interest and passion about it is coming first, being a pharmacist and seeing some of the things that's going on over the years, where we focus on skill, we focus on the academic pieces and some of the things like that, and that's all very important as we try to maintain or restore health for patients. But I also saw a need for there's a big need. That patient is a person, and of course we know that. That's almost an oxymoron to say that. But sometimes I don't know if we have always translated our engagement with the need to satisfy the patient's perspective. So I saw a disconnect a little bit. And then to realize that we don't get training on leadership. But at the end of the day, we are leaders, either of ourselves or the patients that follow us, or our peers, or other healthcare professionals. So, and leadership is just not something that's just natural in essence. I used to believe that there were born leaders. I now understand that there's some people who have attributes, but everybody can be a leader if we work at it. Leaders are made, not really born. They really are made because they come in all shapes, all sizes. But the person needs to realize where they are in the universe, in the landscape, and then do something about that to make a difference. So I won't get into right now. You can ask more questions, but because I could talk about this forever. But I think at the end of the day, my passion comes from seeing a need, realizing there's a gap where we might miss the person on the other side that we're talking to, truly miss them by not realizing that they come to us with a certain level of, they want us to help make sure their life is as good as possible at the end of the day. I don't think they come in to see us as pharmacists or any other health person because they just have nothing else to do. They are concerned about their health and, quite frankly, longevity. And many times fear is underlining some of that. and they need some what I call see me as an individual, and that's challenging because each person is each person. So leaders understand that. So we mix in a lot of things about leadership development and also emotional intelligence, which is a two areas that I focus on, specifically leadership development and emotional intelligence.
I like that. And I like the fact that you're building a basis for so many different types of leaders. And it starts with yourself, as you said. I want to shout out to the listeners right now. You're driving in your car, you're walking, you're listening to this podcast, you're listening to Jerrund. By the way, Jerrund Wilkerson, Wilkerson.com. So that's JERRUND, Wilkerson.com. Take a look. So I'm a pharmacist in a chain store. I have 4 technicians that answer to me and another shift pharmacist. I am a pharmacist in a hospital system. I have other pharmacists I work with, obviously my physician team, care coordinators, and nurses. I'm a specialty pharmacist. I'm in charge of therapeutic interchange pre-authorizations, and I talk on the phone all day with physicians that are calling in about that pre-auth. I'm leading my department in order to make sure that things are getting paid. Those are 3 extremely different pharmacy settings. Every single one of them is impacted by the pencil sharpening leadership skills that you can leverage and continue to refine based on things that you talk about. So pick whichever one you want and kind of dig into that as an example.
Okay. Excellent setup. 3 to 4 different, and they're very, very different. But here's my take, Todd, on this. Leadership is leadership. And whether you're a community pharmacist, whether you are chained, whether you're in a hospital, I think there's some basics that have to be put in place for as a leader. At the end of the day, the leader is about his or her people skills first. There's a saying that people don't care how much you know until they know how much you care. So what does that mean? That means I should not spout data, technical pieces, all of that before I have even lined up with what am I trying to do as the leader of this store, as a leader of this department, as a leader of this hospital, whatever. So there are, from a leadership perspective, and we use an assessment. It's called the work of leaders. And there are 3 components, 3 pillars in this assessment. Vision, alignment, and execution. So that doesn't matter whether you're in a hospital environment, whether you're it doesn't matter. The leader needs to understand that my role as the leader is, 1, to be clear about what am I trying to do? What's my vision? Where am I trying to take my department, my store, my techs? Where am I trying to go? Wow. No brain surgery about that. Where am I trying to go? Most of the time we're not sure about that. Well, as you can imagine, if you don't know, quite frankly, where you're trying to go, how can you help those following you to go? Okay, and let's go back to a basic piece. To the second, we did a survey at second graders and asked them what was a leader. You started off by talking about what leadership is and all the facets. We just asked these second graders, what was a leader? Or who was a leader? Todd, they were so basic. The person who's in front. The person who gets a chance to lead us to the cafeteria. Or the person who is in charge at so the leader has followers. That's the bottom line. They have followers. Now, hopefully it's willing followership, but we know some leaders it's not, but hopefully it's willing followership. So with that being said, again, if there are 3 pillars, vision, okay, leader, where are you trying to take your department, your store, your industry, your hospital? Where are you trying to go? And that needs to be clear. And there's 6 attributes under that. Things such as clarity, things such as being adventurous, things such as being bold and how you might approach things and so forth. So those are assessed. The second pillar is alignment, which basically means, do my followers understand now where we're trying to go? And there's some things under that has to be assessed. And then here's where most of the time it falls apart, and this is where you might need a coach: execution. Now that I've made my vision clear, and now that people understand what it is, aligning with it, now let's get it done.
Yep.
Let's get the job done.
So
And many times that's where it falls out a little bit.
I want to make a comment real quick because you got me excited before we started recording. You made an amazing example as we're coming into the beginnings of summer. To me, that means that my godson, Jelani Stafford, is getting ready for his senior season at UConn University. He is a fullback and he is a defensive tackle.
Okay, congratulations.
Right now, he is going back to the basics. He's starting to condition. He's starting to stretch. He's starting to do everything that he tells me that he was doing when he was 7 years old.
Mm-hmm.
And he's refining and getting ready, because now when the coaching starts, which is different kind of coaching, strength coaching, and
absolutely.
But then the serious play coaching starts, he says that's going to happen probably about August, September. Now they're getting ready for the first game. And you said there's athletes out there that are amazing machines. These people can perform at ways that other people can't, and they make moves, but they rely on their coach to lead them to become a refined version of themselves in order to be better than they were last year. Jelani has no desire to be like he was last year, even though he was amazing. Made ESPN. He's probably going to the NFL. Like, he's excited, but he is mature enough and stable enough to let himself get broken down and take the coaching's feedback, even though it seems remedial sometimes, and start building again. But the building happens 5 times faster than it did when he was 7.
And see, Todd, you just said something to me that highlights again why this is exciting. It's really kind of, I'd like to call it common sense. Part of what, and congratulations on the young man that is doing what he's doing. You said he can be broken down enough.
Yeah.
Well, now I would even like to say the most successful people, and I think anybody can Google this, the most successful people have a coach.
Mm-hmm.
We might call them a mentor, but the difference in a coach and a mentor is there for you, and it's ad hoc, can be PRN, using a healthcare piece. It can be as needed, and it's not necessarily accountability. A coach is a mentor plus, which means he or she understands how you're wired. What's the position that you said is it your grandson, cousin?
That's my godson.
That's okay. Your godson, he's wired a certain way. Yep. He is going to be this, did you say linebacker?
He is a defensive tackle.
Defensive tackle. So now he's going to keep getting better as a defensive tackle as long as he follows his coach. That's right. The coach wants him to be the best version of himself. He realizes, and you already said it, he doesn't want to be as good as he was last year. He wants to even be better.
That's right.
So he has to be open to, wow, look at that. Okay, fantastic. He has to be open to what the coach tells him. And here's the bottom line. What do you think your godson would do, or how do you think it would work if Jelani told the coach, I hear what you're saying, but I don't want to do that.
Yeah.
I don't want to do that. See, that's the difference in mentoring and coaching. If you told the coach, and the coach said, okay, I want you to be a defensive back. Okay, you accept that assignment. We want you to be better this year than last year.
Yep.
Okay. Well, now you got the defensive back thing on your forehead. You're not playing quarterback now. You're not being a linebacker. You are defensive back.
Mm-hmm.
Now let's work on the things you're good at, but also let's make sure we minimize the gaps. And I'm a believer that you accentuate the positive, but you try to also minimize the gaps if you can alleviate them. Because if he's got gaps, the other player is the competitor will realize, here are your gaps. Let's exploit those. So that's where coaching comes into play. But see, many times, I'm sure your godson, he wouldn't know his gaps too well if the coach didn't show it to him.
True.
So that's what coaching, leadership coaching does. We might know, okay, I'm head of a department. I'm the chief pharmacist here. But what can I do better to make sure that I'm the best I can be? And then how can I work with the technicians, those 3 or 4, or whatever I've got? How can I make sure that they are assets and helping the whole group rise?
Yep.
Because here's the net. Everything rises and falls on leadership.
Exactly.
If a place is good, that means if great, it kind of because they have a great leader. If the place or the players are mediocre, they got a mediocre coach. And if things are not so well, bad coach, bad leader.
Yep.
And I know a lot of folk don't like to believe that, but we can just look at football and see when you got a great coach, guess what happens? You win.
That's true.
You can measure the impact of your leadership by the scoreboard.
Yep.
Or by the O's and the W's.
That's true.
And I don't care how we understand that in sports. We understand that a great coach, we might not always like the coach. We might not always like what have to be done. The young men who are out there is hot, sweaty, don't like to do certain things. But guess what? They will, when they win, nothing breeds confidence more than winning.
True.
And if things are not winning, there's something wrong with the leader. At the end of the day, I know we don't like this, but that's what it means. If my department, my team, if it's not playing where I want to, I need to look at me.
Yep.
Hence the reason for coaching.
I agree.
I'm sorry, that went a little longer, but that's about my passion. I don't think we call things what they are.
True.
Top performance requires top leadership. Hard decisions sometimes. Some people shouldn't even be on the team.
Yep. It's very true.
An organization that I'm working with right now, they're going through this with their pharmacists. Some of them are more adversarial because they don't want to follow the leader. Well, my view is there are 2 ways to deal with that. You either get on board or there might be another place that might work better for you, but not here.
Yeah.
Because just because you got your license doesn't make you the king or the queen. You have to learn to collaborate, work with others, and that's what the leader has to do to try to build and ensure execution is happening. And I believe that, quite frankly, there have been years and years that we as pharmacy has been talking about some of the same things over and over. I think we need to have some people who roll their sleeves up, get in, and say, okay, you got your license and congratulations. All that does is let you get a chance to be on the team now.
Yeah, true.
That's it. Automatically allows you to just be on the team. And if you don't want to get better, like your godson, if Jelani doesn't want to get better, I would imagine he wouldn't be in that position very long. Somebody will be on the side saying, "Coach, put me in because I can do that." So Jelani understands that, and he's worked harder to get there and to stay there. And he can see the difference when their team wins, or when he does what he's supposed to do, the number of tackles he's supposed to make, or the number of stops that he makes so somebody gets the touchdown on his side. Okay.
Absolutely. I agree. Hey, listen, listeners, if you're watching us on YouTube, you'll notice that I'm showing you Jerrund Wilkerson's website. Just for people that might not be looking, just remember jerrundwilkerson.com. Look him up on LinkedIn as well. He's active on LinkedIn. Connect with him, ask him questions, maybe how he might even help you or your organization. But be on the lookout for our series that we're going to have dedicated to the pharmacist out there, leadership out there. We're going to get some help from Jesse McCullough with Keystone Pharmacy Insights. And then I told Jerrund, I'm going to want you back to the This Week in Pharmacy show so we can talk more about this and dig into a specific component. But this was a real treat for us to be able to tap into your mind of leadership, and I very much thank you for sharing with us today.
Glad to help, and be glad to talk about some specifics and get into the details of a workshop or something like that as we move forward.
Absolutely. The nitty gritty, the details are important.
Yes, the nitty gritty. It's always about the net and getting down to the granular level of how to do and what to do.
That's right.